Hi guys, I'm Victoria.
Hi, I'm Rosa.
I'm Stasia.
I'm Vivian.
And I'm Cheyenne.
So today we're going to be answering some questions from our patients. How do you determine the appropriate lens type when helping a patient in the prescription?
I think when talking to a patient, we start off by asking what they do, what hobbies they have, kind of just their lifestyle and their everyday.
Yeah, we definitely, they're every day, just kind of figure out, a lot of them might need a work pair, golfing pair. We have a lot of patients just kind of need a lot of different things. So just definitely giving as much information as possible from them before making that call. What experience do you guys have with using optical instruments like a lensometer? I'd say we all have a lot of experience just because that's something that we do on a daily basis. We check them in every day when we get them from the lab, just to make sure they're really good before our patients pick them up. I'm also in the lab, so I'll be running the jobs, and then I have to check it again. So they always help me. We always are doing just 24/7, I feel like. How do you educate patients about the differences between single vision, bifocal, and progressive lenses?
Usually how we educate the patient, usually the doctor will let us know whether they're in a single vision, a bifocal, a trifocal, or progressive. Yes, but we just go with the recommendations and we just go from there and just measure as we needed for a bifocal or trifocal.
I think the doctors do a really good job of kind of figuring out what they need, and then we kind of talk a little bit more with them as well to figure out exactly what they're wanting. Kind of like bifocal measurements, if we know they're semi-drivers, people like that, we do take those measurements into considerations as well. Okay, what steps do we take when a patient returns with issues regarding their eyewear or prescription?
When a patient returns, we do have a 30-day prescription guarantee. So they come in having troubles, we will troubleshoot them, kind of double check the prescription, the measurements on the lens, and see if we can fix the adjustment or kind of find the issue before seeing the doctor again.
How do you ensure accuracy when interpreting a prescription from an optometrist? So I think that goes back to just the lensometer, just double checking everything from measurements to distance between pupil, the prescription. We also have guidelines of the ANSI standards that we have to follow. So we take that into consideration as well when doing that and checking accuracy. What's your guys' favorite part of being an optician?
I think mine would have to be actually helping people pick frames. It's kind of like shopping for another person, trying to find their style with their personality and just trying to get to know your patients closer. Probably my favorite part of the entire day.
My favorite part is usually when they come in with repairs. I like repairing the glasses and just seeing just amazement, just a smile on their face whenever they see a repair that kind of seems unrepairable, and then I come out with it and they say whoa, that looks you fixed it, it's brand new. But yeah, it's pretty awesome just to see the smile on their face, and just repairs are just one of my favorites.
I also like doing frame selects, just finding different frames for people. People want a fun pair, a little more bold. It just makes the whole day really fun.
I'd have to agree with both of them. Honestly, it's hard to pick a favorite. I really like the frame select process just because of the relationship you build with them, figuring out their style. And it's honestly really fun when you find a pair that they love and just to see the reaction. You can always tell when I feel find the one for them. And then the repair part is honestly my favorite part too. Just basically making it look kind of from, sometimes they take it beat up and then we take it out looking brand new, and just seeing their reaction. It's pretty awesome.
My favorite part would probably be dispensing, especially to little kids, because whenever it's their first pair, you can really tell how different they feel. And when they're looking around the room, I just really like seeing how they react to finally being able to see clearly.
I think that is very true, because there's some patients that we see. I had one that was 45, I think it's been like 2 years now, but he'd never had any glasses and he could not see. And I just remember him putting them on and like we literally just hugged and like it made me honestly pretty tearful just to know and like see their reaction, how she said. All right, what are some of our tips and tricks when helping with frame selects?
I think that some of the tips would be to ask the patient for like their budget, what kinds they like, if they have a certain brand they like, if they've seen something that they like on like TV or anything like that, just to kind of figure out what they're kind of going for in a frame. Yes, so we have frames that range from $75, and from there we have the name brands also. Usually those go from 100 and usually a little bit higher. But usually, yeah, we try to see what the patient is going to be looking for and just their budget.
I think figuring out, like you said, what they're looking for, but also what they need to, like durability or just something fun. Every patient is different, so just finding out like what brand really works for them.
I think we have a lot of patients, a lot want them really lightweight, but then we have some farmers that come in and they want them kind of bulky, sturdier. So we have just a bunch of selections with both options. So just like they said, just figuring out what they need and kind of going from there. I think we all know our brands pretty well. So once we kind of get an idea, we just kind of go from there and just start to show them options.
I think before we see our patients, we usually look at their prescription. So if they have something that's bigger or a higher prescription, then it's good to account for how long they'll be wearing it per day. Or if it's their first pair, but it's pretty low prescription, they're only going to be wearing it while reading, then they don't really need to invest in something super pretty or fun or anything like that.
Also with the prescription, it kind of depends on what type of lens they're going to be in, because like trifocals and progressives are going to need a bigger space to go on, so they're going to need a kind of a bigger lens to be in the frame, while single vision can do the smaller frame and things like that. It's just kind of learning what they're going to need in the long run.
Yeah, so I think it just goes back to the prescription and just kind of figuring out exactly what they're needing. There's kind of a lot that goes into it, so we just try to work the best we can with it.
Do you guys have a certain type, style, or brand that you guys like? I would say one of my favorites would be Tura. They're just kind of a little bit more fun and they're kind of blingy. They have some blingy frames, and also Kenmark is usually one of the very good ones, which they do have quite a few brands, but one of my favorites is the Vera Wing and the Kenzies. Those are pretty fun also.
We have Morels too. I really like those. They are really lightweight. Having a bigger prescription like I do, my lenses are a little bigger. So having something lightweight works for me. And having a toddler too, so that helps.
I personally don't really have a favorite. I know I have a lot of pairs of glasses. A majority of them are Tura, so clearly that might have to be my favorite just because of the design, and they're super cute. I get a lot of compliments on them. But then I do have Kenmark. We have Ray-Ban. The Morel I really like too because of how lightweight they are. And they don't have screws on the sides of them, the temples. So durability, like she said with her son, is really good as well. Yeah. We have Ovos. Those are a little tougher to adjust for us. So I know we have a love-hate relationship with them, but overall they're a really good frame, super durable, super lightweight. So that's another good one as well.
I don't feel like I have a favorite brand, but I'm more of like the unique type of frame. I like the fun colors, the fun shapes, things like that. So.
I mainly wear contacts, so I don't really wear glasses very often, but I think a brand that I look at the most would probably be Pro Design, just because I would prefer wearing nose pieces for my glasses, especially for my face type, so I like that that's an option for that type of frame.
Yeah, that brand, like she was mentioning, it has a plastic look to it. And that one you can order them with or without nose pads. So there's a lot of patients that want that kind of plastic, thicker look. And then if, like me too, I need the nose pads. So that's a really good one because then we kind of have best of both worlds for patients. You can kind of go back and forth, order it with or without the nose pads. So.
Okay, well, I think that wraps up all of the questions that we got. So thank you so much for them. If you have any more questions, feel free to drop them in the comments and we can answer a little more too.
Bye.
Bye.